Greetings from Citizen Health and the Team Academy IFAS and MeConnect. And today, in the series of People's Health It Matters, we have Dr. Lavanya, who is a professor in community medicine, GSL Medical College, Raja Mundrik, Andhra Pradesh. A very warm welcome to you, ma'am, on behalf of all the audience.
Thank you so much.
And today
Yeah.
we are going to talk on a very sensitive topic, yet very important, that is infertility. We must know that now in today's time, most of the population are going through this infertility term. Now today we will discuss that what is infertility, what are the symptoms, what are the causes, and how can we treat them. Is it right, ma'am?
Yes. Infertility is a very important topic, and we'll be talking about it.
Right. So, my first question to you, ma'am, that what is infertility?
Infertility is, most of us have commonly heard about it. Infertility is inability of the couple. It could be male and female, or it could be male or female, unable to achieve a pregnancy, that is failure to achieve a pregnancy despite 12 months of continuous or regular unprotected sexual intercourse. So despite having unprotected intercourse regularly, they are unable to conceive pregnancy, they are not able to achieve a pregnancy. So that is what is infertility. But infertility can be of two types. It could be primary or secondary. Primary infertility is mostly like the woman has or the couple has not been able to conceive even one time. They haven't achieved even a single pregnancy. Whereas secondary infertility is they would have had a prior pregnancy, but they are unable to conceive for the second time or maybe third time or like that. So prior pregnancy is there. At least one prior pregnancy has occurred. That is secondary infertility. Yeah.
So, what are the symptoms of the infertility? If we can know only from the pregnancy, or is there any other symptom to know the infertility?
Usually, there are no signs or symptoms of infertility. Mostly, the most common symptom is the inability to become pregnant only. So, how we can mostly think of or maybe suspect of infertility is, say, woman is having a cycle of more than 35 days or a cycle of less than 21 days. Mostly, we can suspect that the woman is having anovulatory cycles. That is, the ovum or the egg is not being produced. So, in that case, we can say that she is probably going for or having infertility. Apart from this, mostly there will not be any signs and symptoms.
Okay, so from doctor's point of view, what can be the causes of the infertility?
So, coming to causes, see, before going through the causes of infertility, we should understand the process, human reproduction process, how it exactly happens. So, firstly, in women, what happens is a mature egg will be produced from the ovary. So, what this egg will reach the fallopian tube. Fallopian tube will take this egg, and this mature egg will be present in the fallopian tube. So, when there is an intercourse, the sperm enters from the cervix and it ascends through the uterus to the fallopian tube. In the fallopian tube, this mature egg and the sperm they fertilize, and now we have a fertilized egg. Once the egg is fertilized, again it travels through the fallopian tube and reaches the uterus. In the uterus, it has to get implanted in the wall of the uterus and then it grows there. So, the causes of infertility, what we can say is disturbance in any of the steps in the whole reproduction process can lead to infertility. Say, for example, ovarian problems like polycystic ovarian disease. Polycystic ovarian disease is a disease in which ovary has multiple cysts. Because of multiple cysts, ovary fails to produce a good egg or good ovum, and so it can lead to infertility. Apart from that, in PCOS, that is polycystic ovarian syndrome, there can be insulin resistance and increased fat accumulation, that is obesity. and all these have to be maybe may have to be managed. So infertility can be caused by polycystic ovarian syndrome, or it could also be due to hormonal imbalances, like for example pituitary gland tumors, or say the hypothalamus is not functioning well. In particularly, two hormones are very important for good ovulation. That is the follicle stimulating hormone and luteinizing hormone. That is what we call FSH and LH. If these are not produced properly, ovulation doesn't occur. And no ovulation, no egg, and no fertility. So that is another reason. Now, apart from ovarian causes, we have the tubal causes, that is abnormal fallopian tube. So that is like if there are blockage of the fallopian tube due to some infections, or maybe trauma to the fallopian tube, or adhesions, intra-abdominal adhesions due to surgery, can lead to blockage in the fallopian tube. If the fallopian tube is non-functional, it can lead to infertility. Then the uterine causes like the congenital causes where the shape of the uterus is abnormal, or maybe uterine polyps or uterine tumors. They can again prevent implantation, or uterine tumors and polyps can cause blockade to the fallopian tube. So the ovum will not be able to, fertilized ovum will not be able to reach the uterus for implantation, or the sperm cannot ascend from the cervix to the fallopian tube because of blockage caused by uterine tumors or polyps. So it can lead to infertility. Apart from this, we have cervical causes like the cervical stenosis, maybe due to trauma, or maybe genetic problems, genetic inheritance, where they have a narrow cervix. So that can also lead to infertility. So these are some of the anatomical causes or the physiological causes of um, tubal blocks or the ovarian or infertility as such.
Ma'am, we have discussed the infertility in women. What about men? What are the
Yes.
causes of in men?
So in men, the causes of infertility could be again obstruction to the reproductive tract, or maybe testicular failure due to varicocele, or maybe due to testicular tumors, or it could be hormonal disorders like again the hypothalamus or the pituitary, or maybe abnormal production of testosterone. So this can lead to again infertility in men.
Okay, so how this infertility can be prevented, ma'am?
So when we talk about prevention, apart from all these causes, we need to know about the risk factors for infertility. Like for example, age. So what is the right age for pregnancy? In women, most of the studies have shown that before 30 years age, and in men before 35 years would be appropriate to for a fruitful pregnancy. So I think most the couple should keep this in mind and try to conceive or try to complete their family. Women before 30 and men before 35. Other risk factors may be cigarette smoking. Cigarette smoking, we all know that it contains high amounts of nicotine, cyanide, carbon monoxide. This can lead to decreased sperm mobility, sperm motility, and quality of the sperm may be reduced. Even in women, this is very important to know that these chemicals which are produced by cigarette can cause destruction of ovules. If the ovules are destroyed, they cannot be replaced at all. So, studies have shown that cigarette smoking women attain menopause 1 to 4 years earlier compared to non cigarette smoking women. So, cigarette smoking should be avoided, especially in women. Then, alcohol consumption. Again, alcohol consumption leads to decreased sperm motility, and quality of the sperm is also poor among women who consume alcohol. Then exposure to radiation, then certain chemicals, stress. Stress is a major factor which is important in infertility these days. Most of us experience stress. Reason may be multiple. So we have multiple reasons to have stress, isn't it, in this developing world? So stress is one of the important causes. Then psychological factors like depression. Depression can lead to infertility, and infertility can further lead to depression. So it is like a vicious cycle. Depression leads to infertility, infertility leads to depression. Another important thing most of us are behind these days is physical activity, exercise. So most of us think exercise is very fruitful. Sometimes in infertility, too much exercise is not advisable. So exercise should be done in moderate quantity. So WHO says that exercise maybe 30 minutes of moderate physical activity per day, most days of the week. That is, most days means 3 to 4 days of a week is sufficient. Doing too much of exercise again leads to infertility. Many studies have proven this. And when we talk about prevention, it is important to take note of all these factors. Okay, so that you can prevent these risk factors and you can have a fruitful pregnancy.
So we are talking about infertility. Now I want you to address the importance of this topic, because many of us may not know the importance of this infertility and why we are talking about the infertility. So please tell us, ma'am.
Yeah, true. Infertility is a very important thing we all should consider. Many a times, what happens is people hesitate to talk about infertility because it is a big social stigma. People feel because they are unable to conceive, they feel they are inferior. They experience depression, social stigma, social exclusion, and familial tensions, community problems. So all these things, people feel that they don't come out, that they have infertility, that they have problems with infertility. And it is this session we are planning, what we are doing here is we are trying to create awareness among people that infertility is just like any other problem. Nowadays it is treatable, and there are many more ways to have children. It is not like infertile couples remain infertile throughout life, not like earlier days. So apart from that, it also, see, we are also experiencing gender bias because of infertility. Like, though men and women both experience infertility, most of the times it is women who bear the brunt of the society, isn't it? So we don't want that to happen. Let there be no gender bias. Let all of us know that both male and female can be infertile, and it could be because of both, any of them. Infertility can result, and lack of pregnancy can be due to reasons in men or women. The other thing is, we all should know that infertility is treatable. There are multiple treatments available, not like the olden days. Now we have many ways. See, like for example, the assisted reproduction techniques. We have made lot of developments. We have different techniques. If if we fail for the first time, need not worry. We can keep trying because there are multiple ways of doing it. If one method fails, we have another method. If not another method, we have a newer method. So there are many ways. So my advice to the couples, to the infertile people is, please do not get disheartened. Please identify that you are infertile. Please make a bold move. Come to the doctors. We are here to help you. You can come to us anytime, and we are there to help you. Yeah.
Thank you so much, ma'am. Thank you so much. It was really nice talking to you. I hope that many of us know about infertility today. And if, unfortunately, if there is any couple who is infertile, will come to know about the situation and won't get disheartened, he will, or they have to visit to the doctor and look forward to the better options. Right, ma'am?
Yes. I would like to add just one more thing. See, despite trying many times, Couples may not be able to have a fruitful pregnancy, but never get disheartened, because the child adoption is always there. Okay, you can go for child adoption services, and government has implemented very good laws now. It has made comfortable for the couples to adopt children without much problem, without any problem. Okay, that's it. Thank you so much.
Thank you so much, ma'am. Thank you so much.